Well, thank you so much, Dr. Conway, for being here today. And just to get started, would you be able to share a little bit about your role at UT and also your research interests?
Yeah, fantastic. So I am an assistant professor at the Steve Hicks School of Social Work, and I'm very interested in doing addiction studies. I've been studying that for about 7 years or so, beginning with my PhD program, and then I did a postdoctoral fellowship that focused on addiction studies. So I'm all about that.
What do you think is kind of something foundational in your research that you've discovered, something that you really want to share with students, with a bigger audience?
Yeah. I think what I found that's more foundational or very important to think about is the very different aspects of addiction. So a lot of my work is guided by what I call the biopsychosocial spiritual model, which basically means that, what happens to us as in health as individuals, there are many different factors that contribute to that. So biology is definitely part of it, genetics and, our health, then psychology, our cognitive processing, how we developed as children. And then you have the social part, which is our social environment, how we're raised. And then there's the spiritual part. Many people have spiritual practices that help them engage and become healthier in general. So when I think about addiction research and my research, I want to think about what are the different aspects in those 4 areas that contribute to possible substance use issues.
That's definitely a very like intersectional, interdisciplinary way of thinking about substance use and addiction. What do you think is like some of the like a challenging part when you're looking at all those different dimensions? How do you synthesize them into one picture?
Yeah, I think one of the most challenging parts is thinking about access to services. So often there are a lot of cutting edge research that comes out with different evidence-based treatments, right? So in the biological realm, we think about medication-assisted treatments for people who are struggling with certain, disorders. And then in the psychological realm, we might have mental health counseling, even recovery support services. But although we can identify treatments and interventions in each of those areas that contribute to health and recovery, a lot of people have barriers accessing those treatments, some of which are lack of health insurance, sometimes lack of transportation to get to where they need to get the help. And so I think it's important to think about what's the best treatment, but also think about how can we reduce the barriers for people getting treatment.
Absolutely. Access to care is such a big part of the equation.
Mm-hmm.
Your research has been so innovative and so important in expanding conversations about substance use, but a lot of times I think especially like on a university campus you find that those dialogues can be difficult to have. So what do you think the role of research is, especially like in academia, to advance those conversations and build knowledge?
Yeah, I think one of the biggest developments in research over the past 20 years or so that has helped to facilitating conversations is this whole idea of thinking of addiction as a disorder that also affects the brain. So many people think of addiction as something you can have willpower to overcome, right? And so people are stigmatized because certain individuals say, well, if you really just want to get better, you should be able to do it. And if you're not getting better, it's because you don't want to, right? But now we know that there are areas in the brain that are impacted by heavy drug use, and that addiction is a cycle That happens not because someone isn't willing to get better, but because certain systems in the brain have changed, right? And so I think that facilitates having conversations when you take the judgment out of it, when you talk to people and you say to them, look, I know you're struggling, and part of why you're struggling isn't about willpower. Part of it is about the fact that your brain has changed. So let's talk about what we can do to help you with that. So that now we look at addiction similar to how we would look at diabetes or cholesterol, something that is happening with you physically that we can help address.
Do you think that that approach has helped dismantle some of those stigmas associated with substance misuse and addiction?
I think it absolutely has. I think what we need for the next step, though, is to have more people discussing it with that approach. Really, right now, it's a bunch of addiction researchers, right, who geek out about looking at the brain and the connections. And, we have it in our minds that, look, it's a, disease that has some brain connections. But I think a lot of people in the general public don't know that. So I think if we spread that information, especially with initiatives like Shift, to sort of remove the shame from having substance use disorders, then it will definitely advance the conversation and people will seek help.
Yeah, definitely. And I think that's probably one of the really interesting things about Shift is really bringing students and faculty and staff and all of those, all different stakeholders into that conversation. And, drawing from like speaking about like awareness building and information sharing. I'm a student, you're a faculty member, what role do you think that people on this campus have in advancing the dialogue of substance use to be more inclusive and to understand all of those nuances? Like, how can we get involved in this work?
Sure. I think it's wonderful that you're asking that question and thinking about it. I think that young people are so creative and so innovative and have so much to contribute in terms of ways that we can expand the conversations, ways that we can improve on preventative initiatives, ways that we can improve on treatment. So I have students reach out to me constantly to talk about my research. And I love those opportunities because I love sharing with them why this is so interesting. I love telling them what they can do to contribute. And I really feel like I'm talking to future researchers. And that makes me very excited. So I would say, anyone who's interested in substance abuse and looking at research should do what a lot of students do, which is get online, look at the different faculty members who are doing that research and get in touch with us because we love working with and talking with students.
Thank you so much. That's so inspiring to hear and really energizing. Is there anything else that you want to add? Things you want to share to students on campus who might have so many questions about substance use? Like, what's one thing that you want them to take away?
I guess the main thing that I want them to take away is to have kindness and compassion with each other. I feel so many times we can be polarized in our views of particular things. So you might have one set of students who are like, I never engage in any, illicit substance use, right? And the people who do are trash. That's some of the things that I hear, right? And then you have other students who are like, well, you don't understand what's going on. There's not a problem with me doing what I'm doing, right? So the takeaway I would like is for people to have a little more compassion for each other. And I think students can support each other a lot more than sometimes faculty can.